you, Mr. Toastmaster, fellow Toastmasters, and our honored guests. The word arthritis comes from the Greek arthron, meaning joint, and Latin itis, meaning inflammation. Arthritis is one of 100 diseases that are characterized by pain and stiffness in the joints. The National Institutes of Health have identified that 1 in 5 people in the U.S. is affected by arthritis. And although it's more prevalent as we age, it is part of all ages. The most common types are osteoarthritis and rheumatoid arthritis, and the most common joints affected are in the hands and the knees. Determining the cause can be difficult because several factors seem to contribute to the development of the disease, but that's a good thing because there are more inroads to treating it. The risk factors include a predisposition, genetics, and as we age, the cartilage becomes more brittle and has less capacity to repair itself. Also, if you've had a previous injury, and under that category I put like occupational stress. My job as an ultrasound tech, I lean to the right over the patient, so for 23 years I've stood like this, and I went to the chiropractor the other day and he said my spine is rotated to the right. Job stress puts more stress on the body, and it has more influence to have problems later. Sports injuries, illnesses like lupus, infections like a septic joint or gout is an infection also of the joint. And all these cause irregularities in the smooth joint surface. Another influence that puts a lot of stress on the joints is having excess weight. It increases wear and tear, and every 1 pound you lose equates to 4 less pounds of stress and pressure on your knees. So even if you lost 20 pounds, that's 80 pounds of extra stress off your knees. But there's another reason why excess weight is a problem. Body fat isn't an inert substance. It's metabolically active, and it's capable of producing hormones and chemicals that actually increase inflammation in the body. By losing weight and avoiding excess calories, you'll reduce the level of inflammation in your body. Another theory about the cause of arthritis is that it's caused by a buildup of toxins and chemicals in the blood. And arthritis is worsened by an overburdened liver that is insufficiently working to detoxify these materials. The liver is one of the biggest detox organs, so it gets overwhelmed. And then the standard American diet influences. We eat too many inflammation-causing omega-6 fatty acids, trans fats, refined carbohydrates. And some people are sensitive to certain chemicals in food. The nightshade family of vegetables, which is white potatoes, tomatoes, peppers, both sweet and hot, and paprika and pimentos are also in the pepper family, and tobacco and eggplant. They contain something called psyllium alkaloids, which cause problems for some people. And also citrus is a problem for some people. It promotes swelling. I actually found out I was allergic to citrus. So treatment is aimed at relieving pain, inflammation, joint swelling, which slows or prevents damage. And I believe the best treatments combine a variety of approaches. We're all unique, and these are all, the things I'm going to talk about now are all options to investigate. So you can choose what intuitively feels like an option you want to try, and you can customize a plan for yourself. And it's always good to work with your medical provider if hopefully they are open to different approaches, because a lot of the drugs and herbs have side effects or interact with each other. So, the drugs to treat arthritis, a lot of them have serious side effects. so it's nice to be able to do other things. There's physical therapy and modified exercise programs. They can use splints for mobilizing a part that needs to be rested. And just listening to your body, balancing activity with rest, reducing emotional stress, eating a healthy diet, and normalizing weight. And then the holistic modalities that I've found to help are homeopathy. Chiropractic helps more with alignment so that you have less wear and tear. Acupuncture is good for pain. And mind-body therapies like meditation and relaxation help release tension, relaxation. Are forms of exercise, especially Tai Chi, Qigong, and yoga are good for that. I was reading about something called balneotherapy, which is hydrotherapy. It sounds really interesting. They use water jets while they're massaging you, and it sounds like something I'd like to try. But so, in going with what we talked about before, foods that support liver health are also good, which are things like garlic, grapefruit, beets, carrots, leafy greens. So all the holistic foods, eating a diet that's an anti-inflammatory diet, you can look online. But important dietary components are the omega-3 fatty acids, which are fish and flaxseed, walnuts, and soy, beta-carotene, and copper, which is in apples, carrots, and ginger, and pineapple. And I found some interesting remedies. Black cherry juice, you can use 4 ounces of that and water, and it's been found to be effective if you have it twice a day when you're having pain. And my favorite was gin and raisins. You pour, you put they only work with golden raisins, but you put them in a shallow dish and cover it with gin and let it evaporate for a week, and then put them in a jar, and you're supposed to eat 9 a day, but a lot of people can't leave it to 9. I have there are some supplements that have been proven effective too. One is called SAMe. There's fish oil and vitamin E. It was hard to keep this time-wise, and so I'll email you out because there are a lot of good ideas. So, and it's good to look at the psycho-spiritual issues, like if you're having back pain, do you not feel supported, or if you have trouble with motion, are there other areas in your life that you feel you have trouble with moving forward? So arthritis is a multifactorial disease, and multiple small changes are key to changing your direction in health, and little things add up. So using an integrative approach gives more and safer options and a higher sense of control, and addresses the whole person, not just the physical disease.